Next, I'd like to invite the UNICEF Brazil official representative, Joana Amaral Fontoura, the psychologist, the director of Vitalev, Dr. Karen Scavacini.
O cineasta, produtor e idealizador
Movie maker who has planned the project and coordinator of SaferNet Brazil, Mrs. Cunha.
Bom, passo a palavra então para a nossa mediadora, Joana Amaral.
Bom, ficar na parte da tarde já nos dá um benefício de que muitos assuntos foram trazidos hoje, né, ao longo das nossas discussões. Então, a gente vê palavras comuns.
We have here common terminology heard in previous panels.
Bastante unido e costura. Então, acho que o objetivo dessa nossa mesa de agora é falar do bem-estar e da saúde emocional em momentos de conexão.
We have a constant connection, and that represents a challenge to everyone, especially when we are talking about children, adolescents. That represents an even higher challenge, and UNICEF is here participating. It's always a great honor to be invited to participate at this workshop organized by NIC.br and SafeNet. I don't know if you have heard about a special case, which is the picture, the image of an egg. Have you seen that on Instagram? How many likes the egg got during the month of January? At World Egg Record.
Na verdade, o desafio foi o seguinte: ganhar mais curtidas.
So the idea is to get as many likes as possible. You know what I'm talking about, I suppose. So the idea was to get more likes than the picture of a celebrity with her daughter. And the picture of an egg went on and reached 50,000 likes. This is just an example to illustrate what I mean by internet. And the egg exploded. That was a campaign to draw attention. And in fact, the internet pressure made me explode. If you are dealing with any problems or issues, just talk to me. And then they present a list of organizations which work with emotional health and mental health. And why am I saying this? Why am I starting my talk with this example? The idea is, or the goal is, how to balance ourselves, how to be part of this environment which works with so much pressure, search for happiness, how to reach a balance and get the best that the internet or connections or networks can provide us. And having said that, now I hand over to the representative of Vitalev, that is a institution which helps to prevent suicidal attempts. First of all, let me thank for this opportunity. What an honor to be here and to be a panelist at this round. Internet safety, and how can we relate that to mental health and to mitigate suicide. Vitaleri Institute was founded back in 2013. Our goal is to improve mental health, prevent suicide, and post-intervention. Anything which is done with someone that is grieving for someone who died due to a suicide. We carry out private and joint services. We give some consultancy sessions, anything regarding suicide. Anytime I talk about suicide prevention, I'm also talking about mental health prevention, emotional health prevention. By increasing mental health, I reduce number of suicides. In the globe, we have over 800,000 suicidal attempts, so an attempt every 3 to 4 minutes, as they try more than they actually conclude a suicide. And this is highly present in the age range between 15 to 29 years of age. In Brazil, we have an average of 12,000 suicides yearly. That's the fourth highest cause in this age range. That means that in Brazil we have a suicide every 45 minutes and 10 to 20 attempts in the same period of time. But that's not much spoken, as that is seen as a taboo and people are afraid of talking about that. There is another survey showing that between 2010 to 2012, there was an increase of 40% in the rates in that age range, and 33.5% for kids over 17 or 18 years of age. And to each 300 kids who try suicide, one executes it. That was the case before they found out what to do and how to do it. We had adolescents in the ER who had a whole package of contraceptive pills, but today they know exactly what to do, how to do it with painless. And it's also known that 20% of youngsters, they behave for self-lesion. With all this information in mind, I searched for that information. In the search tools, you were able to access it. There were several pages showing you or telling you how to commit suicide. However, nowadays, how to kill yourself, painless suicide, or when you try all these words, there is a warning with to give you some support, the CVV toll-free number to help that person. And now I see pages with content talking about the problem, and that can be helpful.
But still, if you have some words, suicide, weapons, it can show you other terms that might be of interest. And if you're curious, you can look at other suggestions. And there are some keywords like hanging, for instance. You can see some videos, images that are extremely serious. So we should perhaps adapt, look into the terms that are most searched, and escape from the obvious, which is the word suicide. There are other ways people can seek for content. And here on YouTube, you have 7 million, 15 million views. It is a challenge of us dealing with a video that has good content and lots of views. Here on Instagram, you have a message of how to help, but still, when you have hashtag, you have the number of hits. So hashtag suicide, more than 8 million quotes, mentions. And that may or may not make people curious. And on the different platforms, we can find it all. People that try to place graphic content, and people that give you 100 reasons not to commit suicide. Here you have Luto do Homem, which is men's mourning. people that lost dear ones. There are posts of people saying that they can't stand it anymore, others that offer help, others who try to sell services, others that share their feelings, which they didn't have before. It's a new room for people to share. Twitter, I put suicide, it ignored, and it just wanted to show me creative presents to your boyfriend. Yeah, funny. Facebook also, when you try to search such of these topics, you cannot see it, but it does complete some things. But you also have help groups like anonymous suicides. People say they don't feel well, and people help each other in a community of care. These are some of examples of other platforms, the Dot and Comma Project, CVV, that use these platforms with good content. Now, are all youngsters the same? Can we think of internet security for everyone? No. We have to see how people use the web. Solutions for mental health, building communities of care based on what they are searching. This is a study that shows that youngsters from the community try to be more disorganized or are more disorganized in searching. They are more open to be helped. And youngsters that are in the ER have a more intentional use of platforms, searching for methods to kill themselves. And they avoid help contents. So we have to understand what kind of crisis they are going through and how they're going to use the platform. Obviously, I'm not going to explain you this whole slide, but just to explain what is the continuum of a suicide and how many things can be trigger factors. And the internet can be a protection factor, and it can be a decreaser of a risk factor. Exposure, identification, and limitations are very important. Why? Because the brain completes its formation at 21. Until then, you are more impulsive. You have less reflection, less self-control, less judgment, less critical thinking, and that reflects into the digital world. These are famous suicidals, and depending on how this is informed in the news, it can increase the number of suicides. I'm not going to talk about the 13 reasons. Ju is going to talk about that. But there was a huge movement of people looking for help and talking about something that no one talked about, which is young people trying to kill themselves. And I think it really brought it out. And this is the result of my PhD dissertation, how we can go from awareness to action. This is what I call 6 C's. People have to understand that suicide is a problem for everyone. There are many campaigns we can hold, capacity building, suicide literacy, that is using this knowledge and transforming it into dialogue, and take youngsters to connection so that they understand others care for them. And that within primary, secondary, and tertiary prevention. Marcel is going to talk about the Eu Estou hashtag. That is, how can we talk openly about suicide, promoting mental health, but Marcel is going to talk about that. Just to close, challenges of this connected world of today. I cannot read my cheat paper. But anyway, neurobiological implications, excessive use of technology, apology to suicide, the feeling of impunity, and that includes bullying and cyberbullying, user safety, limitations, suicides, and to understand what to leave and what to remove from platforms. And the good thing is the building of communities of belonging and care, decrease of taboo, education and well-being, producing quality content that youngsters can have access to, and use algorithms to our favor. This is a path that is still being built. A lot has been done, but much has to be done yet. And just to close, this is an example that the WHO talks about in terms of suicide. There are lots of activities, lots of attitudes we can have, and it's not only offline or online. We have to have access to treatment, public policies, a national plan to prevent suicide, promote mental health for children and adolescents, and responsible education, as well as many other things. Thank you very much. Very quick, thank you. Before going to Marcel, I would like just to make a comment about what Karen showed, a very interesting overview about risks and potentials of the web with regard to mental health. And I think we have really to create spaces for dialogue, for listening, and which is something that children do not have. And I think the Eu Estou hashtag is a very good way to use the space better. Always thinking about security, safety. Lots of panels talked about security and safety, but the challenge is still on. So, Marcelo, it's up to you now. Well, good afternoon. It's a pleasure to be here. This undoubtedly is a project of life. So talking about it to you is an honor. So thank you. The idea of I Am, Eu Estou started with myself and PC Siqueira. He is the first digital influencer in Brazil. He's been on for 11 years, and it stemmed from a need. We wanted to understand what was going on with us and with our friends around of us. And we started to think about what to do, and we decided to create a community of prevention and prevention that is social, for people to come in, talk about that. So we wanted to use Facebook, the web, to be where these children and adolescents are, to talk to them as they talk, using their language. PC knows a lot about that. I'm a movie maker. I know how to produce. So we wanted to put an end to the taboo of talking about mental diseases. I have friends. I have been through an anxiety crisis trying to understand what's going on, and that's how it started. There is a series of contents that we developed based on three main pillars: demystify the idea of suicide, support those who need it, and educate people on how to deal with someone that is going through a crisis. I met with Karen, which is a very, very lovely creature, and we decided to develop these three pillars that we found were the most important to contact people at all points of their crisis, as well as people who surround them, which is also very complicated. Suicide, depression, people thinking it's just a phase, that they're going to be cured. I've been through that. People do not understand what's going on. They don't want to help. They think you're being a drama queen. And it is, if you have a stomachache, you go to the doctor. If you break a leg, you go to the doctor. Why won't you go to the doctor when you're feeling sad? And so we tried to focus on native mobile content because this is where children are. They have their smartphones, their tablets. So it's no use making a beautiful movie with a drone and everything if they are watching YouTube. So we had to talk to them in their space. And we had the intention of the project, which is the growing rate of suicide among the youngest. And NGOs and public services are not being able to deal with the demand. So we knew that there was a demand and there was a need. And we wanted to know how we can talk about that in a good way. So because most of the young just count on their closest friends, they don't have support, how could we foster conversation? So it started out as a project, as a campaign, but today we call it platform, because as Karen mentioned in posts, you write down something and people start to talk, to get engaged spontaneously. And so we created a platform inside Facebook and Instagram. So the strategy is that we created the anti-suicide squad, PC, Karen, myself. So I had someone that went through that, myself, and Karen that knows how to talk to these children and adolescents. She could reach them. So this combination of us three, I'm no one, but I've been through that. I'm looking into the camera and I'm saying, it happened to me. And you can take a look at me. It's PC with 1 million followers saying, I am famous, but I am also a person with depression. I'm sad. And Karen saying, let's do this and that, it's normal. So explaining the technicalities to everyone. So I'm going to show you a bit of the videos, but if you want to know it better, you can just press @I am, eu sou. Fortunately, we have subtitles so you can follow the video. Every 10 seconds you have a message. It can work with or without the audio. The same videos have longer versions, and it's always like this. You have people who are deaf, people who don't have the time, but we want to make it pretty. It shows on your feed. The caption is incorporated in the design so that it makes it easier for everyone. And we also invited Fabio Abu, that is the Pombo Ranger designer, a very known screenwriter, and Vela GV, that together with Vera Sadi made these cartoons using Instagram to show what people are feeling in a more playful way. So it's okay to be in the virtual world, have friends and talk to people. And it's also okay to be in a teaching environment at school and needing someone. And if you had no time to watch the video or read the cartoons, we have the support messages. Just one statement with a message calling you for action. Call CVV, talk to a friend, do something. So we explain why the message is what it is and the call to action in the description. We also created a guide. And you can see it on Instagram. And when you scroll up, there is a guide showing what you can do. So you have the video, and then when you scroll up, you have links, you have a guide how to help people. And what's nice is that you have emails that you send an email, I want to help or help me, and automatically you receive a guide. We don't know, it's all anonymous. We don't know who contact us. We just have numbers. There are lots of people who don't know what to do, and people are coming to get information. And to generate engagement, we hacked the system and we created GIFs. So in stories, if they want to start a talk or to show that they are there, we have a bunch of GIFs saying, I am space, let's talk. Or I am blank here. And so you can say, I am feeling bad. Can we talk? And that was seen by more than 3 million people. So people are using it, which is, the numbers are always impressive. So results are fantastic in terms of numbers. We already have a community of 40,000 people on Instagram, 7,000 on Facebook, more than 5 million views of content. In Instagram, we have videos with 2 million views. So quite impressive numbers. And this number is GIFI with more than 2 million, now almost 3. So I receive lots of messages from people that are afraid of being in the community. I mean, for them not to feel bad that they are following the community, but still they watch the video every week. So we have a lot more views than followers because it's still a taboo. And our content is being used in the classroom in places that would never cross our mind. People in churches, Karen talks about that in their videos. Adolescents talking to the preachers, priests with their parents, but we receive messages that we are being used as support. This is in the inland of the state of Pará, up north, people using us. And there is another result that is truly priceless, which is the messages we get from people that use our content. Whenever I talk about that, I feel like crying and I have goosebumps. The second day, I received a message from a girl. My personal metric was when I receive a message from someone who was touched and decided to give up and rethink suicide because of me, I will feel myself thorough. And the second day, I received a message of a girl saying, I met you on the last day of my life and you made me rethink. So this is priceless. No movie that I can make in the future will have this load of emotion. And now there are lots of things we want to do with Karen. Dani, we thank you publicly. Dani from Facebook, Steve from Christian Shopping. So it was a work of partners. We work with that as a campaign with media to really promote mental health. And we have now a new series of contents, interviews, testimonials of survivors, both of those who tried to commit suicide and were unsuccessful, and those that are mourning those that committed suicide, for people to understand what happens later. We have an educational guide for educators, for influencers, and face-to-face events. That is what we want to generate dialogue. And this is the most important thing. We have to talk. And very soon we are going to expand to the whole of Latin America. If you want to follow us, hashtag Eu Estou, I Am, also on Instagram and Facebook. Thank you very much.
Marcelo, é realmente emocionante.
Marcelo, amazing stories, and that reflects indeed our teamwork. You have mentioned several partners, but you guys as the squad, the pro-life squad, let's name yourselves like that now. Yeah, this is exactly the idea, to have a different speech. Well, I am fine.
Luz ou, enfim, espaço abraço
when you have maybe a virtual hug, a way of embrace those people. Let me just open a parenthesis here. Well, the name of the project comes exactly from that. That's the name, the idea that we are bad, we are feeling bad. When you are with a flu, you are not a flu, right? You are that moment with the flu. If you are a suicide, you are not a suicide. You have that ideation at that time, especially adolescents, that they are very instantaneous. They are like that, but they are not that. If they breathe, if they open for a dialogue, just, have an ice cream, have a coffee and talk, talk and talk. Yeah, they have to perceive their importance individually, collectively, and adolescence has that challenge of learning, daily learning, and how they need references, okay? Someone who's got a very important role in the media, someone who has an important technical knowledge, or maybe a teacher of reference, how to go through that network with different characteristics, features, and potentialities. Thank you so much for sharing, and let's follow that. Now, Juliana, I want to be a bit provocative as we have to emphasize the role of adolescents, how that will help our work or the P work to be valued, and maybe to share a little bit your experience with the Safer Net. If you could add a Safer Lab, I mean, she said. That's a cool initiative to share. And the role of teenagers as part of the network, being virtual or physical or local. Good afternoon. Talking after Isidoro is not an easy task because we fall in love with him, right? He's amazing. I'll try not to breathe as I have too much to cover here in this short time. Anyhow, SaferNet exists for over 12 years, and we are responsible for a national center of denuncias. We have some work with education. Being here today, participating at this event is one of the initiatives where we want to include several sectors to make teachers able. And last, we offer a services, which is a toll-free line to listen to children, adolescents, youngsters, and their online experience. It's important to understand from their perspective how they see those different moments, stories. "24,000 people accessed that service." That's a very interesting service because it can be accessed from anywhere. Adolescents prefer chat and parents emails yet. And this is an opportunity to understand their perspective. Still, when we talk about internet safety, we are more related to as how parents and educators see the problems. But how about them? These are the most frequent situations, such as sexuality, and all those nudes and the consensual about that is the main issue. And second, anything which encompasses discrimination and intimidation among peers, cyberbullying. With that, we have a hint of what bothers the most those people in the web. And there is a case that is very didactic, and it illustrates really well this conversation about mental health, especially when that is caused by the internet, or when the internet is the one to be blamed as the reason for these malicious results. The blue whale case happened around 2 years ago. Following that, there was another version of the Momo's doll, following the same type of pattern. That started in April 1st, Fool's Day. That's quite ironic, isn't it? Based on an Open TV broadcast announcing cases of adolescents, over 130 teenagers who committed suicide in Russia. And the year before that, in 2016, a Safer Internet in Bulgaria had checked out that announcement, and it was supposed to be unreal, not proved. And that reached Brazil. And the blue whale thing, what was supposed to be a fake news, became a reality. And in the first week of April, there was an increase over 1,000% searches involving this term, suicide, blue whales, and all of that disseminated to a number of other news and misinformation about that episode. Then there is a curve. Here, April 19, that was a peak. I was in our headquarters, and we stopped all day long just replying reporters and journalists who were totally astonished, not knowing how to deal with that problem without collaborating to its dissemination, as that is the main challenge in the web, how to inform people without adding to further dissemination, raising panic among communities. And that was the day when we went out of control. We had to clarify media, press, parents, and schools who were really concerned about that. We published just a note to the press. Actually, it was not a note, but rather a large, long text in the Facebook with a organic development, and that was well received by readers, as we were facing an environment of little information. And that was a note disseminating recommendations by WHO mainly. So we spoke to the press how we should approach that and what can be done, who can they look after, what sort of services they can do. We also promoted the SaferNet help line. SaferNet helps line helps those who had suffered any sort of violence in the web, and that was a chance for those that were under a more vulnerable condition that could be assessing that content related to blue whales and how seek for help. In partnership with CVV and Facebook material, helping people to identify signals like that. We know that internet and social media, they are a environment where people may ask for help, they can shout for help, but it's important to identify who are those under risk and what signs should we follow and what to do to help them. And we understood how important it is to offer qualified information from reliable organizations. We participated at over 5 public hearings, and several others emerged as a consequence of a blue whale, panic was generated, and regulatory standards had changed. Internet regulatory framework, they become a discussion when things like that impact the public opinion. What happens with the regulatory framework afterwards? And to close, I'd like to make a comment here still about blue whale and the second episodes of 13 Reasons Why. 13 Reasons Why is it's a serial TV on TV which was highly criticized in their first season, and we had in the helpline. We were available 24 by 7 in the helpline, and that was available. That link was available in the page of 13 Reasons Why. With that, we had the chance to listen to many adolescents, and there was a great pick of accesses guiding people and family members how to address that topic. And this is the pic showing what happened once 13 Reasons Why was launched. That was launched in Brazil last May with over 13,000 access. Here we have the whole number of accesses that was kept in the following month, where we have noticed that there were far too many people willing to talk about suicide, depression, and bullying, which was another aspect quite frequent present in that film. And any issues regarding emotional and mental health are topics which will matter to adolescents who would like to talk about their agonies, what they suffer, what they are facing. I cry for this or for that. That was a great opportunity to raise that conversations, and they are mostly willing to have that chance. And some other reports, such as sexual violence, and those girls that also used our service to report and describe nasty experiences like that. Unfortunately, we lack of channels to give opportunity to this public to talk about things like suicide. And a university addressed a survey to understand what is the impact of suicide with family members, with youngsters and friends. And this is just a starting point, and we know that campaigns, they also have the same goal. Of course, that they will need a network, and you were talking about that, Karen. How can we do that in a coordinated manner by several players? And in my opinion, 13 Reasons Why was positive in that sense, as it worked as a mirror for what was hidden and not outspoken. And with that, families, they were somehow obliged to talk about that. 95% of parents, interviewed parents, told us that their kids made some type of question about that topic after they watched the film. And how can we address those issues or touch contents that should and must be addressed accordingly? With that, you can help and you can raise a channel for discussion. This is exactly our helpline for those of you who would like to access it. So what is the role of adolescents in this, in a statement with their stories or not, and how is that spread or polarized in the web, and how can Safer Lab illustrate it? I will never give up, believe me. Well, I didn't have time to cover all of that, but it's still in that stories debate. With the case of blue whale, there was even an attempt for the pink whale. How do we create solutions to online problems? Problems created in the web, and the web has that power. At what extent can we create responses, stories, and initiatives that somehow would be a contra story? And in case of 13 Reasons Why, we also had 13 Reasons Why Not. With that, we had, the character had a list of whys, and then we decided to create the list of why not. At what extent can we invite people to talk about it? So I am in favor, I advocate for talking freely about suicide. Just by talking, we can create stories that are pro-life and not against life. The idea is to promote life, senses, and adding to that, we have an example of some topics that we were not even mentioning that were raised by girls. Maybe a girl saw a comment in somebody else's post, and then they created their own channel of discussion for sexual harassment, sexual violence, or abuse. And it's just a matter of building that up, and people will come freely. And going back to Safer Lab and our experience where young people, they become main characters of of these stories, as they are the meme generation, GIFs generation, that fast speed, telegraphic and visual communication. And why shouldn't we talk about positive things and about safety? That may sound a bit boring, but how can we take that into a content that will address that culture of internet, GIF, memes, and so on? How then to produce content, how to bring upon light their stories with their own way of speaking, writing, reading, and understanding. We have to understand that they are the main players and not us anymore. We have to go after solutions. Yesterday, participating at a workshop who are Instagram influencers. What are they consuming, and how can we talk about that system that will involve it in a positive way?
And what languages are possible? Comic strips, cartoons, videos, whatever language makes sense to them so that they can see themselves in the situation. Karen, I have a question. You talked about the importance of data. And I think this is also a challenge to have reliable data for us to think about public policies that can have a dialogue with this information. And we are talking about that nationwide. So what I would like to ask, and perhaps just to stress, the importance of thinking of public policies for the prevention and to put suicide in the national agenda. You said that in your presentation, but could you talk a bit more about that, if you could share? For us to think of concrete actions, because one thing that you bring that I think is very nice is call for action. Of course, it's important to talk and discuss things, but we need concrete actions because the life of each child, teenager, or adult has a price, and we have to think about it now. Well, with regard to data, we believe that the numbers are 34% higher than the numbers we have. And even the last epidemiological bulletins have a different view on reports because they are very general. We have to be careful. For instance, there is a decrease in the case of adolescents, but those that most commit suicide are the elderly, and no one talks about that. So we have to analyze numbers in each region, because when we are talking about suicide, there are many reasons for it to happen. Youngsters in the north and northeast have different motivations than those in the south, southeast. So when you analyze data, you can understand how they correlate to behaviors. And then you can make platforms on the internet to show solutions that are compatible to their risk factors. So we would have to have a greater commitment of gathering data, correct data, so that we know how big our problem is. Studies show that depending on the religion of the physician that is making an autopsy, he's going to write down suicide or not. Every suicide case has to be investigated by the police. And the numbers that we have on platforms talk about the death certificate, that sometimes you have crushing of organ X. It's not spelled out as suicide. Sometimes I have groups. Each one of you would write down suicide as a death certificate. Out of 10, just one said yes. So we can have a much greater number. And we can use the information we have today to have specific questions to each region in Brazil. Well, I got a question that I think has a lot to do with what was said. If you want to send more questions, no, we don't have time, sorry. So I'm going to read this one that I received that I think is very important. And it reflects a demand on schools, which I think is something that people are talking a lot about. On January the 30th, a girl in school committed suicide. The teachers were surprised. She was an excellent student and had good relations with teachers and classmates. Is there a suicidal profile? Can you identify it? Well, this is about a half-an-hour answer. There are signs. There are signs that we can teach educators and classmates, but signs are not clear. Some signs just make sense after death. Sometimes a statement that didn't make sense makes sense afterwards. So they are signs, they are not certainty. And there are many adolescents that can hide their feelings very well. So no one kills themselves if they're happy. This is a fact. If she killed herself, there was something she was not saying, because suicide is a way to communicate the suffering that she couldn't communicate otherwise. You can look at the main signs. I could mention the main signs, but we have to go beyond the signs. You have to think of how you can promote inside the classroom mental health. And some youngsters say to their colleagues they are thinking about committing suicide, and they ask their friends to keep quiet. And what we say is, it's best to have a friend that is mad at you than to have a friend that has killed themselves. So signs are just the tip of the iceberg. There are many behaviors and actions that have to be developed in school for the whole of the school to prevent suicide. Not only educators and classmates, but parents as well. We have 2 or 3 videos about that in Eu Estou, to see signs and to start a conversation and listen. Active listen is very important. If you're not ready, do not start to talk, because you're going to make it worse. So we have now a new series. There is a testimonial of a girl, 12-year-old. She had a bad mark, and she jumped out of a window on the 4th floor. And she's paying the price for that 20 years later. And we talk about that in these videos. Before we finish, I would like to ask a question. Eu estou happens because 10 years ago, a friend of mine said that we have a superpower. We tell stories, and we could use it for good. And I try to do it every year. Last year, I did it out of need. I needed to do this, and I found partners. So whenever I have a talk, I say, you all have superpowers. Listen, talk, conduct a survey, influence someone, and we can help people. So this year is going to be a very hard year for Brazil, fully polarized. Let's use our superpower. And Karen remembered we have a podcast. If you want to feel good, the podcast is called De Boas. Myself and Tavão. So real stories in the Eu Estou community. Like I started college, I adopted a kitten, or I did not cut myself today. For some people, it is victory. So 15 minutes, you're going to feel good because in the micro, it's everything good. In the macro, sometimes not as much. But let's feel good. And let's use our superpower for the good because it's good. Thank you. I am thankful for your talks. I think it reflects an intention, a positive inspiration, and we hope to carry on. Thank you, everyone. And now we are going to go to the next panel. Thank you very much.